one of the amazing things, well, you guys can probably guess from just hanging out with Karen for this bit, is that her coworkers really rallied around her and made a trip to Salem to speak directly with the legislators about how this practice of taking health care benefits away from someone when they have a catastrophic illness would be not tolerated by the employers of Lane County. And her colleagues donated their sick time to her to help her so that she could focus on her healing and not have to focus on navigating the loss of health insurance. And I think, you know, her whole community of people made a difference not only for her but for all of Lane County employees, because there were some legislative changes which are now happening nationally about, you know, when you get diagnosed, you can't just get dropped. I mean, of all the people who need health care, that's when they need it the most, and that's what it's for. So, but it's a very stressful time. You can imagine being diagnosed with something like multiple myeloma on top of, you know, this condition that you're actively researching to find out that you have no coverage.
No job, no coverage.
No job and no coverage. And being a very active, community-oriented, vibrant, independent person, what that feels like to be put in that position and have to tell people, you know, I have no job, I have no insurance, when you've always taken really good care of yourself and your own responsibilities. It's a very humiliating experience, but she came through it because she's very unique. Special. Okay. I'd like to talk, depending on the client or the patient, I would then talk to her about things at home. You know, usually there's a form that they filled out. If there's a family member, is there a particular activity or thing that you like to do that you find that you're limited in? How is it going with bathing? How are you doing in the restroom? How are you doing getting in and out of your bed? What is your home situation like? Can you enter it safely? Are you able to access activities that you'd like to go to? Some people have grandkids that play volleyball. I can't go up the bleachers, you know, and so, is that something you would like to work on? Yes, I would. We have a lot of gardeners in this community. I like to garden, but I can't get up off the ground, or I can't bend down, or I feel like I'm going to lose my balance when I walk out in my garden. So we look at an activity of daily living for that person so that when we select interventions and we come up with a treatment plan, those are going to be one of our outcomes. And then I can relate to Karen. I know this activity may seem tedious, but what we're really working towards is your ability to kind of weed your garden or vacuum your home, or, you know, clean your shower or do your laundry. So we'd have those types of conversations and kind of looking at what it is that she'd like to focus on as an activity of daily living. So that would be part of it. And then depending on where she lived and who she lived with, I may look at some basic fall recovery strategies. So if she's on the ground, does she know how to get up? And or can she get up? She may know how, but is she able to problem solve that? And that, particularly in a skilled nursing setting, it may frame your discharge recommendations in terms of the setting. If they're not able to do fall recovery, it may help you connect that person to Lifeline or some other service where, you know, they're trained to activate the button if they get down and can't get up. So we might do those types of things in an eval, and I guess it would depend on time. I had the luxury of a fair amount of time and knowing Karen very well, so I could go straight through it. But as Mark mentioned, with these patients, you definitely spend at least a half an hour reviewing the medical history before you even walk in the door. And then if you've got anxious family members close by who really need to make a connection with you and need to know that you know what you need to know, and for assistance, I think that happens probably more so than with us, because we start the evaluation process, and if you're the next person to come in and start therapy, well, where's the other person, and what do you know, because they've made this connection with me, and now they don't know our connection, so they're not sure about what you're going to bring. And so, go ahead.
Yeah, I think it's always so important, you kind of alluded to this, that you share with the client. Okay, so often they'll see a new person, they want to share their story and say, well, you know, I just had a conversation with Christina, your physical therapist, and she told me, and you tie in something that Karen shared with Christina, that, you know, you're working on balance strategies because you shared with Christina that you fell 2 weeks ago, and so they go, oh, you have read my chart. And so there's an instant rapport, relaxation of the client when they know that you know something about them. That's so, so important versus jumping in, oh, we're going to start doing imbalance activities and taking them out to the parallel bars and doing stuff. They're not going to do so well that way. They'll do okay, but they're not going to get hooked on you as a therapist if you don't make that connection of what you do and what Christina's doing. especially with a confused state too. They may not fully understand some of these neurological challenges of the connection of an assistant with the PT, or how you're different than speech or OT. They kind of lump them all together. So I think it's really important. Yes?
So in a situation like that, like let's say they're not comfortable with that, can you say, Christina delegated to me to do some activities with you? Like, so they know that it came from you, or should we not use, like, is that okay to do?
Oh, I think it's very okay to do. Yeah, absolutely. Yep. Explain, you know.
Just to make them
Yeah.
be sure that it did come from her, and it's
Yeah.
not just like, okay.
Uh-huh. Yep. And just use really comfortable language and, you know, get right up close to the client and talk to them at their level. I think these are just really important things. You've observed Christina doing that versus, you know, watch body language. It's so important in getting clients to buy into you. You smile. Don't smile inappropriately and say, oh, I fell yesterday. Say, oh, really? You know, sometimes we just get so enthusiastic we lose touch of our facial muscles. Yeah, talking at your level, it's your things you're going to learn, and you're going to learn that by watching other therapists do it really well, that modeling. But I mean, what is your perspective here when somebody new comes in? What
I was
works?
going to say, I've been really, really fortunate because, again, teamwork is good in everything. In the facility that I go to, they work very well together, and I've been treated, you know, worked with PTs and PTAs, and it's been wonderful. And I think when it's a new person, you do kind of hesitate just for a minute, and you're kind of watching their body language and how they are, you know, the warmth coming from them, and if they're trying to assist in any way, you know, and that type of thing. So just, you know, be there and smile.
That's right. One thing I asked Karen to talk about, and we've done this before last year, was I asked her to share when she was working with physical therapy, one thing that really resonated with her as a real strong positive, and then one thing that she saw as a challenge. And we'll just be trying to do that when we have our speakers too, to the best of their ability, you know, being able to share with you from the patient-centered perspective, you know, what do they really like, and lets them keep coming back for physical therapy, and what was it that they'd rather not do again, or that you know, perhaps somebody that they didn't want to see anymore because of an interaction. So if you wouldn't mind sharing that.
This is kind of difficult because like I said, most of my interaction with them has been very, very good. And because they seem to care so much, because again, if it hadn't been for the physical therapist, you know, who knows when I would have gotten to the hospital to find out I had a fractured back, you know. That's why I was in so much pain and cancer. And then they also, when they were working with me, you know, found that I had shingles, and got me into the physician early enough on that too. Sometimes it's a little frustrating because my condition, and some days are worse than others. You know, I know they're trying to really show me and stuff, but if I'm tired, it's like, oh, gee, do I have to do this again? You know, that type of thing. So that bothers me, and every once in a while, I feel I've gotten maybe too many exercises, you know, to do, because there's so much going on, and I know that they're all very, very important, and I want to do all of them, and of course I want to get as well as we can, and with this condition we don't, you know, there's not that much known about it. So they're just doing everything they can, you know, to work with me. But so then sometimes I'll have to say, can we kind of get together and break this down and maybe have 5 main ones? So, you know,
Right.
it's been good.
I think that's really true for the more chronic or the conditions that don't get all better, you know, and you have, particularly in the pediatric population, you've got a parent who's really going to, you know, they've been told if you do this, your child is going to improve, and then they've got 40 things that they're supposed to do with their child from just you. And then they've got the OT, and then they've got the speech, and then maybe they got the vocational person, and then maybe they've got school homework, and it really does get overwhelming. So checking in and saying, you know, do the exercises seem relevant to you? Do you feel like there are too many of them? You know, do you feel like they all make sense to you? Do we need to update them so that we can kind of consolidate some things a little bit? Because we often kind of are moving along and we forget that there maybe was therapists before us. I've had patients bring in their exercises, you know, 3 or 4 treatments later, and say, well, this is what the other PT gave me, and I've been doing these, and I'm doing